Welcome to surgery at ThedaCare. We are so excited to see you. We understand you may be having mixed emotions of excitement or anxiety about your upcoming surgery. In this video, we will go over the different types of anesthesia you may receive. For every patient, we plan for the type of anesthesia they will receive during the case. However, after discussion with your anesthesia provider, on the day of surgery, this plan may change. If this is the case, your anesthesia provider will review why the change is occurring and provide education on the new anesthetic plan. However, before you come to the hospital, there are things you can do to have an optimal experience. Prior to your surgery, you will receive specific instructions on when to stop eating and drinking. It is incredibly important that these instructions are followed to prevent food or liquid from entering your lungs during anesthesia, a complication called aspiration. Make sure you stay hydrated with plenty of water up until your drinking cutoff time. Dehydration can make it harder to place IVs, lead to post-operative nausea and vomiting, and prolong your recovery time. Make sure you follow your medication instructions to prevent your case from being canceled on the day of surgery. Avoid alcohol and recreational drugs for 7 days prior to surgery. Dr. Zenzik has joined us today to help give an overview of anesthesia, what to expect the day of surgery, as well as the risks and benefits for each type of anesthesia a patient may have.
Hello, and thank you for entrusting ThedaCare and your anesthesia team to take care of you for your upcoming surgery. I'm Dr. Alex Zenzik, an anesthesiologist and the Surgery Optimization, or TSOC, medical director. On the day of surgery, after you have arrived in the preoperative holding area, you will meet your anesthesia provider. Your anesthesia care team may consist of a physician anesthesiologist, a nurse anesthetist, or an anesthesiologist assistant. Prior to meeting with you, your anesthesia provider will review your medical record, medications, allergies, previous problems with anesthesia, and any relevant preoperative testing that you may have had. Your anesthesia provider will discuss with you the options for anesthesia, but will likely recommend one of these options tailored to which surgery you're having, as well as your medical history. Your anesthesia provider will answer any questions or concerns you may have regarding your anesthetic. Our job is bringing you safely through surgery. Your anesthesia provider will be with you throughout the procedure, ensuring your safety and comfort. Now we'll talk about each type of anesthesia with each of their risks and benefits. We will first talk about general anesthesia, which is what normally comes to mind when patients hear the term anesthesia. General anesthesia will make you completely unconscious and pain-free during surgery. You will not be aware of what is happening during surgery, and you will not feel pain. General anesthesia is very safe. Though most patients do not have serious problems from general anesthesia, there are some associated risks, including nausea, vomiting, sore throat from the breathing tube, drowsiness, allergic reactions, breathing difficulties, and anesthesia awareness, which is very rare. Older adults, especially those with baseline dementia, may be at increased risk for confusion after surgery. To decrease the chance of confusion or thinking problems after surgery, do brain games or brain-stimulating activities every day leading up to surgery. Also use your glasses and hearing aids as you normally do if you have them. Being with friends and family you know well might also help maintain good brain function. Your team will guide you through your anesthetic process. However, you can expect the following. Shortly after you arrive in the operating room, your team will apply monitors to watch you closely during surgery. Then you will breathe oxygen through a mask. You will then receive medication in your IV that will make you unconscious, usually within 15 to 30 seconds. Most patients under general anesthesia have a breathing tube carefully inserted shortly after they become unconscious. When surgery is done, typically the breathing tube is removed and you are brought to the recovery room or PACU to be closely monitored as you wake up. Monitored anesthesia care, or what we call MAC, involves using sedation to help you relax and remain comfortable during the procedure, while local anesthesia or blocks are used to numb the surgical site. Unlike general anesthesia, you remain conscious, though you may feel drowsy or be sleeping lightly from medications administered through your IV. This approach is commonly used for minor or moderate procedures. MAC results in less grogginess and nausea compared to general anesthesia and will allow you to resume normal activities sooner. Sedation received during MAC is also very safe, but again has potential risks, as the medication used for sedation may slow down breathing. Rest assured, your anesthesia provider is there to monitor you closely and keep you safe. Also, some patients may experience mild drowsiness, dry mouth, or slight disorientation after the procedure.
Post-operative nausea and vomiting can sometimes occur after receiving an anesthetic, but there are effective ways to prevent and manage it. Before your procedure, your anesthesia provider will assess your risk factors based on your medical history, the type of surgery, and previous experiences with anesthesia. To reduce the risk of nausea, your care team may use anti-nausea medications before and during surgery tailored to your needs, adjust anesthesia techniques to lower nausea risk, such as using less or different medications that are less likely to cause nausea. Optimize hydration, as dehydration can increase nausea. If you experience nausea after surgery, your care team can provide anti-nausea medications to help relieve symptoms. Staying hydrated, slowly reintroducing foods, utilizing aromatherapy, and staying in a calm, quiet environment can also aid in your recovery.
Besides general anesthesia or sedation, your anesthesia provider will also help with pain control based on the surgery you are having. The most common ways this will occur is with spinal anesthesia, nerve blocks, or with pain medications given through your IV. In spinal anesthesia, medication is injected into your lower back to numb the lower half of your body. You'll be awake, but may receive moderate sedation to help you relax and feel comfortable during the procedure. Spinal anesthesia provides excellent pain control for surgeries involving the lower body and has been known to provide a faster recovery compared to general anesthesia, with fewer side effects. Some risks associated with spinal anesthesia include headache, low blood pressure, soreness at the injection site, nerve damage, bleeding, or infection. In the operating room, the nurse will help you sit in a special position with your back curved away from your abdomen. The anesthesia provider will clean the skin of your low back with antiseptic solution and then inject numbing medicine into your skin. Next, the anesthesia provider will put a special needle into your back and position it in a very specific location. Numbing medicine will be injected through the needle before it is removed. The nurse will help you lie down on the operating room bed. Within 2 to 10 minutes, your lower body will start to feel numb. Once we know that the spinal anesthetic is working, you'll be given sedation medication through the IV that makes you sleep during the surgery. It is very common for a nerve block to be used for pain control for surgery. A nerve block is used to numb a specific area of the body, combined with sedation to help you relax. With sedation, you will feel sleepy and comfortable throughout the procedure. Benefits of peripheral nerve blocks include effective pain relief in a targeted area during and after the procedure. For some patients, nerve blocks reduce the amount of anesthesia needed and thereby reduce grogginess and nausea after surgery. Some risks of a peripheral nerve block, which again are uncommon, include temporary tingling or numbness, soreness at the injection site, nerve injury, infection, bleeding, and an incomplete block that requires more anesthetic sedation. Typically, as a patient, you will receive sedation medicine before beginning the nerve block to keep you comfortable through the procedure. Before performing the block, the anesthesia provider will clean and numb up your skin before utilizing an ultrasound machine to help visualize the targeted nerves at a location dependent on the type of surgery. Numbing medication will be injected through a needle close to the target nerves before it is removed from your body. Next, we will review local anesthesia without sedation, which is typically used for minor procedures. Local anesthetic is typically injected by the individual completing the procedure, not an anesthesia provider. Local anesthesia provides targeted pain relief and numbness so you do not feel pain, but you will remain awake during the procedure. Local anesthesia provides focused pain control, quick recovery, and has lower risk of side effects. Some risks of local anesthesia include mild discomfort or stinging at the injection site, minor bruising and swelling, allergic reactions, infection, or accidental injection into a blood vessel. Your healthcare provider will clean the area to prevent infection. A small needle is typically used to inject the local anesthetic near the site of the procedure. You may feel a small sting or pinch as the medication is administered. However, the area will quickly become numb and last for a few hours.
Controlling your pain after surgery is an important part of your recovery. Proper pain management helps you move, breathe deeply, and heal faster. Here's what you need to know. Post-operative pain control. Communicate about your pain. Before surgery, tell your care team about any medications you take and your pain management preferences. After surgery, report your pain promptly. Describe where it hurts and how intense it feels. This helps your team adjust your treatment plan. Multimodal pain management. Your care team will often use a combination of methods to control pain. Medications. These may include non-opioid options like acetaminophen or ibuprofen, nerve blocks, or opioids if necessary. Non-medication techniques. Ice packs, positioning, deep breathing, and relaxation exercises can help reduce discomfort. Set realistic expectations. It's normal to feel some discomfort after surgery. The goal is to reduce your pain to a manageable level so you can rest and move, not to eliminate it entirely. Stay ahead of the pain. Take pain medications as directed. Even if the pain feels mild, waiting too long can make it harder to control. Prevent constipation. Some pain medications, especially opioids, can cause constipation. Drink plenty of fluids, eat fiber-rich foods, and ask about stool softeners or laxatives if needed. Know when to call for help. If your pain is severe, worsening, or unresponsive to medication, contact your care team.
We are so glad you took the time to learn about anesthesia here at ThedaCare. We will see you soon and look forward to getting you back to your unique best life.
On behalf of ThedaCare, we wanted to thank you for allowing us to be part of your healthcare journey.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.